Welcome to Wednesday Wellness. Today we're going to talk about carpal tunnel syndrome. My name is Dr. Romina Ghassemi. I'm a chiropractor and I've been in practice since 1995. And to every Wednesday, I give back to the community by helping people understand their symptoms and understand if they need help, where to go get help, and what home hacks they can do in order to minimize or manage their pain until they seek professional care. So these are the tips and things that I teach my patients in the clinic. Hopefully this can help you in any way possible. I practice in Los Angeles, California. If you need to get in touch with me, you can always call our 800 number or reach me via email. So let's talk about carpal tunnel today. So what is carpal tunnel syndrome? Carpal tunnel, basically, if you break down the name, carpal means the bones of the wrist. There are 8 bones in your wrist area that are very tiny. And when they connect together, they make almost like a crescent moon. And then they're covered by a soft tendon that creates a little tunnel, almost like a half circle. And we call it a syndrome because it's an accumulation of symptoms that the patient shares. So this is the tendon sheath that you can see. And underneath it, the tendons and the nerves are going underneath. Carpal tunnel syndrome is a common condition. It causes pain, numbness, tingling in your hands and your arms. And it occurs when one of the major nerves, there's a median nerve, ulnar nerve, and radial nerve, which I explain to you all later. But when any of these nerves are irritated or compressed or inflamed, it can travel and it can skip your shoulder, arm, neck area and go directly to your wrist. And it's in most patients, carpal tunnel gets worse over time. So the earlier you treat it and the earlier you address it, the sooner you get relief and the less problem you'll have. Tendons are extensions of muscles, but let's see where these nerves come from. Remember I told you about the 3 nerves? Well, the nerve roots of these nerves come from your neck. So if you already have forward head carriage, or if you know of a loved one that drops their head forward or their earlobe is not aligned with their shoulders, these nerves are irritated. The nerves of the neck, the nerve roots, come from the level C5, C6, C7, and C8, and also T1. So what they do, they exit out of your neck and they run under your clavicle and they go under your armpit, where we call the axilla, and they formulate a group of nerves called the brachial plexus. And they run through your arm and they split out and they split again around your nerve, around your wrist. So your thumb, your index finger, and your third finger, those are where the median nerves are at, and that's median nerve. So if you're feeling symptoms over there, that's your median nerve. We are going to be assessing it from your wrist, elbow, shoulder, and neck. So we're going to just have checkpoints. Where could it be coming from? The last 2 fingers, your little finger and your ring finger, are your ulnar nerve. And I'll explain the radial later on. So the pain that comes originates from the neck and radiates down to your hand and gives you numbness and tingling in your fingers is not carpal tunnel. It's actually coming from your neck. Carpal tunnel usually is also compressed with the shoulder, and it results in pinched nerve in your wrist or your fingers. And they sometimes tend to overlap each other. But today we're going to kind of break it down a little bit to make it easier for you. So let's talk about the carpal nerves. Remember I told you about the median, radial, and ulnar nerve? That's where they come from. So if you take your fingers and you put it right around your neck, where your little finger touches your hairline, the second and the third digit, the third and the fourth digit are going to be these 2 fingers. Where they touch, that's around your C5, also known as your median nerve. Right below it is your radial nerve and then ulnar nerve. And if you look at the front and the back side of the whole hand, these are the sensory stimulations of those nerves. So nerves carry 2 functions. They sense and they have motor functions. So they tell the muscles what to do and they also feel. So these 2 sensory and motor functions of the nerves are expressed over here, and this part is going to be the sensory stimulation. So again, look at the yellow part, the palm of the hand, that's median nerve, and the tip of your fingers. The radial nerve is more on the front of your hand, and on the palm of your hand on the outside is your ulnar nerve. And we'll talk about the other musculocutaneous, radial nerve, and auxiliary nerve in the different, auxiliary nerves are usually C5. But for the conversation today and for this webinar and this presentation, we're really going to focus on the ulnar, the radial, and the median nerve. And if you're feeling any sensation in your forearm, you're looking at musculocutaneous nerve, tennis elbow, golfer's elbow. We'll talk about those later. And let's talk about thoracic outlet syndrome. Thoracic outlet syndrome sometimes is misdiagnosed as carpal tunnel syndrome. That is when the nerves in your armpit get compressed. And that's why they call it thoracic outlet, because the nerves are coming out of your thoracic spine right around here. And when they get pinched down there, you will feel sensory stimulation or numbness and tingling and symptoms in your wrist. So carpal tunnel, even though you're feeling your symptoms in your hands, but definitely you want to check your armpits. For those of you who have rounded shoulders, and you already notice that when you wear clothes, you have a little crease around your shoulder areas, or you feel like you're getting a hump in the back of your neck, you're already developing what we call upper cross syndrome, also known can cause symptoms of thoracic outlet syndrome. All right? And that means this outlet where the nerves are coming out of the thoracic area are being compressed. So again, you feel like you have a little muscle wasting. You feel a little wasting around the thumb, base of your thumb. You feel tingling in your arms and your fingers. You have pain in the arches. You feel you have pain and aches and in your neck and shoulder, and you have gripping problem. So you can't grip, or you feel like things are falling off of your hands. This is very typically seen in dental hygienists and also hairdressers, because their job is their arms are around their chest level, they're moving with their hand, and they're holding heavy items over a long period of time. So rounded shoulder tends to be very common. Also, kids who wear heavy backpacks develop rounded shoulders, and those are the things that we have to address. The clinical aspect of thoracic outlet syndrome is when your first rib, sometimes the first rib is compressing the nerves as well. So that would result into a surgical intervention. But first, correct the posture, and you'll notice a big difference. If you correct the posture and you still have thoracic outlet syndrome, you definitely want to contact your primary care physician, chiropractor, orthopedic doctor. Let's look at the anatomy. Your tendons are an extension of your muscles. So there are a group of muscles at the palm of your hand that are responsible for you making a fist. These are called flexor tendons. And then the tendons that are at the back of your hand are extensor tendons. They're the ones that lift up your wrist into, if you were to do a high five like that, or if you're clenching something, is your flexors. They are innervated by the nerves that come from the median and ulnar and radial nerves. So moving your wrists in 360 degrees of rotation requires a group of muscles that allow it to move forward, backward, sideways, and pronate and supinate. So those are very important that we address the muscles as well as the nerves as well as the tendons. So we'll talk about all that. Carpal tunnel is not just a group of nerves that we're looking at. It's actually a group of tendons that run through the hand. And I could show you right here where the tendons are being covered by the tendon sheath. All right. So I try to keep it as simple as possible. So let's talk about the symptoms. If you feel burning, tingling, itching, numbness in the palms of your fingers or extension of your fingers, you definitely know that you're suffering from some kind of a neurological problem caused by compression. That compression could also be inflammation, which is as a result of arthritis. Also, a lot of pregnant women get carpal tunnel symptoms because of the inflammation in their body. If your diet is off, it also can cause inflammatory response. So you know that if certain foods cause you inflammation, you definitely and certainly have to go through an elimination process. But let's go through a couple of things. Weakness in your hands. If you are typing on the keyboard and you feel like a shocking sensation, you definitely have a positive sign, which we'll discuss later, of carpal tunnel problem. You things tend to fall off of your wrist, or you feel pain when you're bending your wrist in a certain position. Or during night, you feel your hand is worse at night versus during the day. And the motion in the hand is the primary indicator of carpal tunnel syndrome. So let's do some self-test. So go ahead and there's two major tests that we do in carpal tunnel. One is called Phalen's, the other one is Tinel's. Phalen's is when you put your hands together, the back of your hands together, flex your wrist, and for a maximum of about 60 seconds. If you feel sharp tingling pain in your fingers, that's a positive Tinel's test. Those are specific indication of carpal tunnel. That's a positive Phalen's. Now, Tinel's is different. Tinel's is when your palm is straight and you start tapping on your wrist, where your wristband or where your watch is. Once you start tapping on your wrist and you feel like a tingling, then that would mean that you have a positive test for carpal tunnel. So any kind of pain, anesthesia means like a lack of sensation. Paresthesia means tingling sensation, like hypersensation. Those are also positive signs. So let's talk about some exercises you can do. So there are active ranges of motion, so you can stretch your hands, and these are excellent exercises to do when you are sitting on the computer or spending a lot of times on your keyboard. It's crucial, or there has been cases that some patients who drive a lot, they tend to get carpal tunnel syndromes when they're holding the steering wheel. So you want to make sure that you stretch your hands anytime throughout the day. The more you stretch, the better it is. If you feel like you're dropping things and you feel like you're a little weak, make sure you get a stress ball and you start squeezing that ball. That is a passive strengthening exercise, and it's called a grip strengthening exercise, and that would definitely help you. It would be wonderful if you can do some massages on your hand, and this is what I explain to my patients. Put your hands in a warm tub of water, and let them just soak and marinate. Add some olive oil, vitamin E oil, and start massaging your hands with the oil. This would really, really help you. If you're suffering from any kind of arthritis in your wrist and arthritis in your fingers, paraffin baths are going to be very effective for you. And you could definitely massage your hands after the wax comes off of your hand, which you can buy on Amazon anytime you want. So active range of motion, finger exercises, wrist stretches, tendon glides, and also grip strengthening. Wrist flexion, bending down, and extension are going to be very helpful. If you have acute pain, the wrist flexion and extension exercises can easily be done by rolling a ball on a table forward and backward. You want to make it as light and listen to your body. If it's too much, back off. But if you can handle it, go for it. And always try to see if you can push about 20% above your tolerance level. If you can, move on. If you don't, and stay to the tolerance level. So things that you want to avoid. You want to make sure that your wrist is always straight or in a neutral position. And that is where your wrist lines up with your forehand. This is the easiest way. If you're a side sleeper, try not to put your hands or your wrist under your chin or under your face. So make sure that your hand position is comfortable by adding a pillow. Avoid holding objects in the same way for a long period of time. This is specifically for my hairstylist, my dental hygienist patients that tend to have types of jobs that requires them to hold items for a long period of time. Adjusting your desk, your keyboard, which we'll discuss later in depth. Wearing a splint at night is going to help reduce the numbness and tingling and aggravating it, so help you to sleep. And minimize repetitive hand movements. If you know you have a certain pattern, interrupt the pattern. A lot of people are developing carpal tunnel syndrome due to the constant flexion of using their phone, being either on their smart devices for too long, not just the keyboard. And try to alternate between activities and tasks, and stretching in between. If you're chatting or if you're listening to an audio on a webinar, utilize this time to do some stretches of your hand. Forward, down, stretching forward, stretching backwards of your wrist. So let's talk about your posture at work. I mean, it's right now with COVID and right now with the situation that we're mostly working from home, it's very hard to find your comfortable position from the bed to the kitchen counter to the sofa to dining room and then back on the floor. Finding a comfortable position, it's a little challenging, but see if you can find one station that you can stay at, and that would be your workstation. And take breaks from your computer. Make sure that your wrist, your elbow has to have an elbow rest. If you do not have an elbow rest on your chair, it causes your shoulders to be elevated, aggravates and induces rounded shoulder and poor posture, which can cause thoracic outlet syndrome. It also overexerts the muscles in your forearm, which can cause symptoms of carpal tunnel problem. Make sure that you adjust your seat so that way your posture and your thighs make a 90-degree angle with your body. And make sure your wrist and make sure your wrist is comfortably positioned, or get a pad that is supporting and comfortable for your wrist. So things that are wrong position. If the heel of your hand or your wrist is at the edge of a chair or a table or the keyboard, it will cause aggravating problem. Positioning your keyboard sideways or positioning your computer sideways, it causes your wrist to be in too much of a hyper lateral bending, which we call a hyperabduction or adduction. And if you're leaning your wrist on your mouse, so the position that you want to be is, if you look at the right position, you want to keep your wrist straight or slightly bent. That's a very comfortable position. Using the mouse, your wrist and your forearm have to be on the desk, so that way you're not causing a flexion, right? Those are the key factors that you want to use. And if you need some time to get used to that, practice it. Try it a couple of times and then eventually break the poor habits into good, healthy habits. Rounded shoulder and thoracic outlet syndrome is usually caused by poor ergonomics. So looking at those pictures, which one of them do you think you are? When you're involved in your work and you lost it, involved in your work, which position do you find yourself? Which one is your pattern? So correcting those is essential, because it will cause nerve compression in your neck, your shoulders, while you're getting symptoms of numbness and tingling in your fingers. So changing your posture is going to be immensely affecting the aggravating or secondary factors that cause carpal tunnel syndrome. Because sometimes it's really your posture and aggravation of those that causes carpal tunnel syndromes. And it is a syndrome. It's an accumulation of symptoms. We just want to isolate it if it's really coming from your wrist or is it coming from your posture. So what kind of solutions are out there? These are the typical wristbands that you can find when you do a Google search or if you go on Amazon. If your pain is mostly in your wrist and you find yourself mostly having wrist pain and forearm pain, it's better to get a wrist brace. And I don't particularly like the second one, even though it helps a lot. You just have to be very careful so it doesn't compress your thumb area, so we do not get an aggravation of your thumb. I like the gloves better because they actually help compress the area, especially if you have any kind of swelling. The other kind, the last kind that has actually a hard device under the arm, I think those are the best ones. Just be careful the way you wrap around your thumb so you do not cause a compression on your thumb and make that aggravation. But before you go into a wrist brace, there's another option that you can take. and that is kinesio taping. You can buy these from CVS, and my favorite type is a rock tape. Those have been most effective, but I'm sure your physical therapist, personal trainer, chiropractor can use any of these other tapes that they use. Kinesio taping for carpal tunnel is very important that you hyperextend your hand slightly by about 10 to 15 degrees. You start from your thumb and you go all the way diagonal to the side of your elbow. The reason you do that is because you want to reduce the amount of overload on the muscles, and we're trying to protect the tendons that are running through the carpal area. Then you do the other side, and that is going from your hypothenar, the other side, which is this around your pinky, and cross and diagonal go to your elbow. And then you do this, and then you wrap the wrist around. Now, this is one method. There's another method is if your hand is flexed forward and you're getting pain, you want to keep your hand in a neutral position. So you definitely want to make sure that that tape is sitting right centered on your third index and run straight through up to your elbow. Most of the wrist taping is always done from the wrist to the joint that the muscles originate from. The muscles that allow your hands, your fingers to flex, your fingers to extend, for you to grab something or just rotate your hand, all those muscles originate from your shoulder, elbow, and run through, and the tendons are the ones that are moving the fingers. So taping is very essential to be done from the origin insertion of the muscle. If you feel that you have pain with thumb movement, this is a great way to tape your thumb. And you could also, if you feel like your pain is coming from your elbow area, this is more of a golfer's tennis kinesio taping. But going back to posture, it's very important that you correct your posture. Correcting your posture and taking care of your wrists are both beneficial. So if you think that your problem could be coming from your posture, let me give you some posture tips. How you choose your pillow and how you sleep at night is essential, especially if you're suffering from, if you wake up with wrist pain, wake up with weakness in your hands, or your hand pain or tingling wakes you up at night. So let's recheck your pillows. There's two types of pillows. There's the one that you feel good, and there's the one that are ergonomically positioned that are functional for you. So it's a feel and function that you have to assess. So find the kind of pillow that you feel good with, then use that kind of type of pillow, and then utilize and get it in a position that get the feel goods, get that consistency and get that quality of pillow in a functional pillow that works for you. I personally, if you have forward head carriage, I recommend number 2, number 4, number 3, and number 6. These pillow type and shapes are going to be extremely beneficial if you have forward head position. If you have more of a rounded shoulder and you do not have that forward head position, then you could definitely invest in the rest of these pillows. But personally, I think 2, 3, 4, and 6 are the ones that are most beneficial for patients, even if you don't have a straight neck or a reverse curve. So what I did is I put together a package that I recommend to my patients. This is specifically for people who are suffering, who feel like their numbness and tingling in their fingers are coming from their neck or their shoulder or feeling radiating pain. This kit is going to be extremely effective. One, you traction the neck to remove the pressure from different levels of the neck. Then you're going to use massage balls to reduce the muscle spasm and do your exercises on your muscles. And the resistive band is going to help you in order to strengthen the muscles. It does come with a posture support that helps improve your posture during your activities of daily living. This kit has been accumulated and put together specifically for you if you're suffering from radiating pain from your neck and upper back, which you can find on our website. This one is if you just have stiffness and have occasional achiness in your hand. This is more for people who have stiff neck problem, upper back problem, so stiffness and achiness. This one is, there's no traction in the neck, but it's also more of a correction of the curve in the neck. So there's a chiropractic cover, there's a posture corrector, there is a resistive band to strengthen your muscles, and there's massage balls. Now, this part is specifically designed to correct the curve of your neck. So if you have straight neck, forward head carriage, reverse neck, this is going to be a great passive exercise you can do at home. The wearable posture corrector, you wear it throughout the day. That's what it looks like. And it comes in black, white, or nude. And it changes your posture and hacks your nervous system in keeping your body into an upright position and does not allow that thoracic outlet or rounded shoulder. Once you utilize this prevention method, you could use the massage balls to get rid of the knots in your muscles and also use resistive band to strengthen the weak muscles of your back that are causing you to have poor posture or rounded shoulder. The reason I recommend the BAX-U posture support is because you have a choice of buying a lot of other posture products on the market anywhere, right? The problem is most of these, almost every single one of them, compress your armpit right there. Remember we talked about the nerves that come from your neck and run through your arms into your fingers? Those brachial plexus cannot be compressed because if they are with these products, you will get numbness and tingling. I recommend BAX-U because if you have flex spending account, health savings account, it's also covered under that. It's backed by university studies with University of Michigan. We did a lab study checking with surface EMG, x-rays, vibration platform, respiration, and we wanted to see, does it really, really help? And it was documented that it does. 12-week studies proved that 90% posture improvement and 75% reduction in symptoms. Also, it's soft on the skin, so it doesn't cause any kind of shaving on your skin, and it gives full range of motion to your shoulder. So there's no compression like the other products. So that's why we do recommend that. And it's unisex, and it also comes for kids, for pediatric version. Every Wednesday, I come to you and I share my information and my knowledge in order for you to have a better life. Many of you I may not see, and many of you I may see in the clinic, but my goal is to help you have a better life through my knowledge, and hopefully I can make a difference in your life. Our next topic is going to be trigger finger. So that's when your finger suddenly triggers and it flexes. It's also known as stenosing tenosynovitis and or trigger finger. It has been commonly seen because we're using our computers and our phone a lot. So hopefully these webinars are helping you, and please share it with your friends. And if you have any questions, send it to us. We will send you a survey. This survey is going to tell you where you are on the scope of posture, shoulder, rounded shoulder, forward head carriage, and and what health tips can we give you to have a better life and a prevention of your symptoms. Again, these are all for information and for benefiting your health. If you do find that these tests that you did are positive, please contact your primary care physician, contact your chiropractor, your physical therapist, your orthopedic doctor, or let us know. We'll try to help you and guide you in the right direction. Thank you again for your time. I really appreciate it. Send us your questions in the comment section. We'll respond to you as soon as possible. And don't forget, we're here to help you. Have a wonderful day, and thank you for participating.